Finally, we have Wendy from E-Heza.
Hi, my name is Wendy Leonard, and I am the founder and executive director of the Ihangane Project. We are achieving lasting improvements in health outcomes, beginning in Rwanda, by facilitating community-driven solutions that strengthen national health systems. Today, I'm here to talk with you about E-Heza, Rwanda's first point-of-care digital health record, created hand-in-hand with frontline healthcare workers to dramatically improve health outcomes for mothers and children. E-Heza, unlike other e-health solutions, is a permanent health record for pregnant women and children. It is designed by and for nurses and mothers to support their workflows. It inspires healthy behavior change through the use of data trends. Progressive web app technology allows nurses to work on or offline, and it delivers timely and reliable data to the Rwanda Ministry of Health. E-Heza strengthens relationships between nurses and mothers by building trust, encouraging return visits, and enabling healthy behavior change. For example, when a nurse enters a child's measurement, she can immediately see the child's nutrition status and can compare today's measurement with the measurement from the previous health assessment. Progress reports show all the child's measurements over time, color-coded based on nutrition status, and real-time data trends allow nurses to tailor the health education she provides specifically to the mother and child in front of her. There are multiple flexible workflow options. For example, nurses can work in English or Kinyarwanda. They can also shift between group health assessments and individualized care. They can see all of the activities that are going to be conducted for all children that day in the health assessment. They can, for example, check the weights, who has had their weight checked, who needs it to be performed still, or they can shift to individualized care and conduct all activities for one child at a time. E-Heza is designed for expansion through ministries of health around the globe. It is based on gold standard clinical care protocols established by the World Health Organization. It links to DHIS2, which is the database used by the Rwanda Ministry of Health and by over 60 countries around the globe. And any number of new modules can be added to address other chronic conditions such as HIV, diabetes, or heart disease. The Rwandan Minister of Health herself has asked that we expand E-Heza throughout the country by 2020. In doing so, we will improve the quality of care to nearly 500,000 mothers and children in that time. And the East African Health Research Commission sees E-Heza as a critical tool for rural health facilities throughout the region. We will track impact on the quality of care, the efficiency of care, both in terms of finances and data reporting to the Ministry of Health, and maternal and child health outcomes. Thank you.
Questions? Pop, and then Katya.
Thank you for a great presentation and potentially a very helpful solution for Rwanda. My question is just what assurance do you have that your technology will be selected outside of what the Minister of Health said? Because Rwanda is a popular, very popular country, and there have been so many solutions being implemented there. So what assurance do you have that you're going to get that government commitment to really do this?
First, I'm a physician, and I actually went to Rwanda in 2006, and I started working at the Ministry of Health and being asked to go to this community and make sure that they were implementing on the ground the Ministry of Health protocols, which they weren't, but there were a lot of systematic reasons for that. So we worked together to figure out how to make that happen, meet local priorities at the same time as meeting the Ministry of Health priorities. So when E-Heza came about, we actually started it because we were working with nurses to use data trends to improve the quality of care they were providing. So when we started developing E-Heza, we started with the Ministry of Health and said, listen, this is what we want to do. They said, if you want to do it, that's great, but you need to meet our needs. And we've been doing that ever since. So now the Minister of Health, not only has she said that she wants this expanded throughout the country, we've worked at all levels of the Ministry of Health and the local level to build that ownership and engagement. So that's your question.
Thank you. Could you talk a little bit about how it will be or could be taken beyond maternal newborn health? I'm thinking if you go kind of to to the effort of creating an electronic journal for a person, why would you only use it for that and then kind of create another one and another one and another
I
one?
completely agree. And as a physician, you know, we see this where there's all these siloed situations, but really at the end of the day, you want one record that serves a family, that serves the community. The benefit of E-Heza is it's already designed for these group versus individual sessions, and also using the data at the point of care to educate the patient. So whether you're following a hemoglobin A1C, which is the measure for diabetes, or you're following growth trends, the technology is actually very similar. And so we will also make it open source that will allow us to be really good at what we do, but also allow others that are looking to create that diabetic module, looking to create that cardiovascular module or the immunization module. All of those, we can all be working together to build this into a robust system.